So guys, sit down please. I told you the squamous part of the frontal bone, it has different features. From external surface, you can see supraorbital margin, supraorbital foramen, superciliary arch, glabella, frontal tuber. These are the shape of the squamous part from external surface. Also, we can see this region from inside, internal side. I told you you have some shapes for the brain, and also you have frontal crest. Here, frontal crest, falx cerebri. Falx cerebri, I showed you. This part of the dura mater attached to the frontal crest. Frontal crest goes down and finally attached to the ethmoid bone. I will explain for you what is that here. So the next part of the frontal bone is orbital plates. Orbital plates. These are roof of the orbit. Look at here, right side and left side. They are located in the roof of the orbits and they are orbital plates, right and left. As you know, orbital plate right and left, orbital plate right and left, they are not attached together. And you have a space between these two plates, and this space is U-shaped. We say ethmoidal notch. Ethmoidal notch. It means you have two plates, roof of the orbit, between them is empty, ethmoid goes to this space, and its ethmoidal notch is for ethmoid, for the ethmoid bone. Orbital plates from outside is like this, roof of the orbit. It has some space for lacrimal gland and for the trochlea. I will explain for you. You know that lacrimal gland, lacrimal sac, and nasolacrimal duct, these are three parts. The gland is here, upper lateral side. The gland, lacrimal gland is here, upper lateral side. So you have a depression here. It's for lacrimal gland. We say lacrimal fossa. Secretes the tear on the eyeball. When you close your eyes, okay, when you close your eyes with eyelids, the tear from lacrimal glands come here to lacrimal sac. In the medial side of the orbit, in the lacrimal bone, we have lacrimal sac. Collect the tear. Then tear from this lacrimal sac goes to the nasolacrimal duct and goes to the nasal bone. Goes to the nasolacrimal duct and goes to the nasal cavity. So orbital plate has this fossa for lacrimal gland. Gland is here. Lacrimal gland location is here. Orbital plates from external surface and orbital plate from internal surface. Look at here. This one. Roof of the orbit from upside, you can see that. And look at the ethmoid bone. In the ethmoidal notch is roof of the nasal cavity. It's here. Between ethmoid and frontal, here ethmoid goes to this notch, okay, and roof of the nasal cavity. Between this connection, you can see two ducts. Here we have two foramen between ethmoid and frontal here. You have two foramen here. They opens to the orbit here. So what happened between ethmoid and frontal bone orbital plates when this U shape ethmoid goes to this region? Two foramen from inside, they go outside to the eyes here. From inside, they opens to the eyes. Look at here. Anterior ethmoidal foramen and posterior ethmoidal foramen. You have two foramens in the orbit. Where is it? Between orbital plate and ethmoid bone. After lacrimal bone, this white color is ethmoid, some part of ethmoid. It means here. This is lacrimal bone here. This is lacrimal bone. Behind the lacrimal bone is other part of ethmoid. Ethmoid has different part, I will tell you. So here you can see two foramen between orbital plate of the frontal bone and ethmoid here. These are anterior and posterior ethmoidal canal. So where they open, look at the canal from anterior ethmoidal, posterior ethmoidal. From inside of the cranial fossa, from here, they opens here into the orbit. So in the orbit, it means anterior cranial fossa has two connection. One, by these foramens in the ethmoid, they open to the nose, nasal cavity, olfactory nerves, and by these two canals, they open to the orbit. Also, they open to the orbits. Two canals open to the orbits. Anterior and posterior ethmoidal. Another points. When you see this picture, you can see that around this U-shaped notch, you have some cells. You have some cells. Look at here. These are air cell. Air cell. So when U-shape, ethmoid goes to this U-shape, this lateral part of the notch, it has some air cell. Other part of the ethmoid complete them. Imagine frontal has this, ethmoid has this, and they become complete air cell around this notch. So ethmoid here, complete these air cells to the half of the air cells, complete air cells. So the ethmoid sinus is here. The ethmoid sinus empty space is here between ethmoid and frontal. It's important. Again, I will tell you in the ethmoid. So this notch, ethmoidal notch, is for the cribriform plate, this plate. But around this notch, we complete the air cells. You can see that here. This half of the cells attached to this half of the cells, and these are ethmoidal air cells. Look at this picture, you can understand it now. Around this U-shaped frontal has some air cell. When ethmoid attached to that, it complete to the, yes, complete the air cells of ethmoid. Notch is here. In the ethmoid, I will again tell you and you can understand it better. So, this is orbital plates. Let's talking about nasal part. Nasal part of the frontal bone is for nasal bones. As you can see, nasal bone attached to the nasal part. And the name of this suture is frontonasal suture. The name of this suture is frontonasal suture. What is the name of this suture? Between two nasal bone. Internasal suture. Like maxillary suture, between two maxillary bone. Intermaxillary suture. When the two bones is same name, you say inter, between them. Intermaxillary suture, internasal suture. And nasion is here, nasion. I told you, this location is nasion. then internasillary suture attached to the frontonasal suture. This midpoint is nasion. It's nasion. So also nasal part has a spine, nasal spine. It goes down and it's for attachment of the nasal bone. The last part is zygomatic part. The last part is zygomatic process. It's here. The last part is zygomatic process, and it's located here. Zygomatic process attached to the zygomatic bone. So this is frontal bone with a squamous part. You can see frontal tuber here. Frontal eminence tuber for the, I told you, center of ossification. A squamous part, orbital plates, nasal part, and zygomatic process. These are 4 different parts of the frontal bone. Metopic suture. I told you frontal bone, it was pair in the fetal period and in the newborn. But after 6 months, 9 months, it fused, and because we don't have suture, it's one bone. Sometimes this suture, metopic suture, doesn't disappear and stay. What does it mean? It means it's not completely fused, it's not completely ossified, and it's bony. So what is the reason? And what is the reason? So it's related to some genetics factors and growth factors. No problem. You should pay attention to that. For example, you take you take a radiological image from a skull in a patient, and you see this line, and you say this is fracture. Yes, you have fracture. No, it's not fracture. And this patient say, no, I didn't have any damage experience, or for example, trauma. It's normal. So you should pay attention to this. This is metopic suture. In some cases, maybe it's not completely fused. Sometimes this opening of the metopic suture is very severe and become like this. So it's very obvious from the skin, as it's very obvious in the skull. But usually it's like a line. But in the normal condition, it fused and we don't have metopic suture. And I told you, sometimes metopic suture close very soon. And what was the shape of the skull if it closed very soon? Triangular, trigoencephaly. If metopic suture close very soon, we say trigoencephaly. If it's not closed, it's be open, we say open metopic suture, like this or like this. What is this green color? Greater wing of a sphenoid. I will tell you. I told you this H shape is pterion, frontal bone, parietal bone, temporal bone, and this one is greater wing of a sphenoid. So articulation of the frontal bone, you don't need to memorize that. You know that frontal bone posteriorly attached to the parietal, attached to the nasal, attached to the different bones. So this slide talking about different bones, frontal bones attached to them. Parietal bone. Parietal bone. Parietal bone is a flat bone in the roof of the skull, in the calvaria. It has one external surface and one internal surface. It's pair bone of the neurocranium. So look at here. This is the shape of the external, and this is shape of the internal surface. It's not very difficult bone, it's flat. You know the sutures. First of all, you should know the name of the sutures related to the parietal bone. For example, this one is sagittal suture, This one is coronal suture. This one is lambdoid suture. The name of the point, bregma, lambda, and this structure you can see here. From outside, from external surface of the parietal bone, you have 3 points. One of them is these foramen, parietal foramen. These foramens, 2 centimeter anterior to the lambdoid suture. This is lambdoid suture, 1 or 2 centimeters anterior to this suture. You have a small foramen, one right side, one left side, parietal foramen. Why we should have foramen here in the top of the skull? Why here we have foramen in the skull? Always we know that the foramens are located in the base of the skull or anterior side base. Why here in the top of the skull we have 2 small foramens for the scalp? What is the scalp? Yes, exactly. A skin and tissue in the top of the head. We say a scalp. No, it's not for a scalp. For veins? Which veins? Emissary veins? What is emissary veins? Yes, it is for emissary veins. Yes, it is for emissary veins. What is emissary veins? Emissary veins. We have some veins in the skull. We call them emissary veins. Emissary veins, they are very small veins, and they connect the veins from outside of the skull to the inside of the skull. So what is the benefits? They can balance the pressure of the veins in inside of the skull and outside of the skull. Balance the blood pressure. Emissary veins. So these small foramens usually for emissary veins. So a small foramens in the skull, usually emissary veins passing from this foramen. So parietal foramen is here. You can see that. 2 centimeter anterior to the lambdoid suture. I told you one anatomical landmark. I told you between 2 parietal foramen, this point on the sagittal suture, it has name. And the name of this landmark is obelion. Obelion is here, between 2 parietal foramen. Another structure we can see in the external surface of the parietal bone is parietal tuber or parietal eminence, like frontal. We have 2 round structure. In the parietal also we have here these 2. Again, they are for ossification, primary center of the ossification. Another point from external surface of the parietal bone. We have 2 lines. We have 2 lines. Temporal line. What is that? Look at the picture. From here, zygomatic process of the frontal bone. Here. From zygomatic process of the frontal bone to, first of all, we have 1 line, then divides to a 2 line. Look at here. From zygomatic process of frontal bone, 1 line goes back and make a circle here. This circle is the region of the temporal fossa. The name of this circle here is temporal fossa. But look at the temporal line. Start from zygomatic process of the frontal bone, then go back and divide to the 2 line. Inferior temporal line is more obvious, and also superior temporal line. So, superior temporal line and inferior temporal line. Finally, inferior temporal line comes down and attached to the temporal bone. So these are temporal line. Why we can see lines? Always lines are the location of attachment of muscles. Which muscle is here? Temporalis muscle. Inside of this fossa, we have temporalis muscle. So why we have 2 lines? So one muscle, one line. No, inferior temporal line is for muscle attached here. But superior temporal line is for fascia of the muscle. It's for the fascia of the muscle, and you can see them. So as you can see, this line, temporal line, starts from frontal bone, but some part of this line is located in the parietal bone. As you can see, these parts of the superior temporal line and inferior temporal line is located in the parietal bone. So you can see that. Superior temporal line, inferior temporal line. So this structure you can see from outside of the parietal bone. Parietal foramen, superior temporal line, inferior temporal line, and parietal eminence or parietal tuber. These are three structures. Let's see inside of the parietal bone. We can see three different shape. One, these circles. Two, these lines, like root of the, for example, tree. And three, this groove. So inside of the inside layer, inside surface of the parietal bone, we have a three structure. What are these circles? Why we have these circles here? What is that? Granular fova for arachnoid granulation. Granular fova for arachnoid granulation. What is that? Very good. CSF is in the subarachnoid space between arachnoid and pia mater. I told you it's turning around the brain, spinal cord, come back. So finally they should absorb to the veins. We have some granule. Granule means round structure. We have some granules in the arachnoid. They collect this CSF and send it to the vein. We call them arachnoid granulation. They are in the arachnoid, yes, because CSF is in the subarachnoid space. And these locations, they are a space for these granules. Arachnoid granulation. The name of this fossa, because they are small, we say fova. Granular fova. Granular fova. Who produce the CSF? So here absorb and go to the vein. Who produce the CSF? CSF is produced in the brain ventricles. Brain ventricles. Brain also has some empty space. They have ependymal cells. You will study in the neuroanatomy, I think, next semester. Okay. The next structure is this lines. What is that? Yes, it's for artery, branch of artery. Grooves for branch of middle meningeal vessels. I told you outside of the dura mater, we have middle meningeal artery. Fracture of the terion can damage the middle meningeal artery, and we have extradural hematoma. So it means it's very close to the bones outside of the dura mater, and it's very close to the bones. You can see the location of the artery inside of the parietal bone. Groove for middle meningeal vessels. And the third one is this. A big groove here. We have a big groove here at the center of the parietal bone, sagittal sinus. What is that? It's here. Groove for superior sagittal sinus. Groove for superior sagittal sinus. What is superior sagittal sinus? Vein. So why we don't say vein? Superior sagittal vein. Why we say sinus? Sinus is like sinus of the nasal cavity, paranasal sinus. Again here sinus. Yes, sinus means big space. When we use it in the bones, paranasal sinus, it means empty space in the bones. Here in the veins, when we say sinus, it means these veins are very big and they have big space. Usually for the inside of the skull, we have sinus, we don't say vein. We have some vein inside of the brain, but this in the meninges, inside of the meninges, we say sinus. One of them is superior sagittal, and this is groove for superior sagittal sinus. Okay? Again, articulation of the parietal, we know that anteriorly attached to the frontal, posterior to the occipital, laterally to the temporal, medially attached to the midline. We know this. Occipital bone. Occipital bone. Occipital bone again is a single bone. Where is the location of the occipital bone? Look at here. It's like this. Not just posterior, also in the base. Posterior and base. Look at here. This is occipital bone. It's in the posterior side of the skull and also in the base of the skull. Is very obvious. And the landmark of this bone is foramen magnum. Foramen magnum is very important. Foramen magnum. Based on the foramen magnum, you can divide the occipital bone to the 4 parts. The first part is posterior side of the foramen magnum, posterior and superior, this side. This is again a squamous. Again, this is a squamous. Like a squamous part of the frontal bone, here, occipital bone has a squamous part and it's here. Anterior side of the foramen magnum, anterior and in the base, we say basilar part. Look at here. Posterior and superior to the foramen is a squamous part. Anterior to the foramen is basilar part. Lateral to the foramen, right and left. Lateral to the foramen, right and left, we say lateral parts. Lateral part, lateral part. So it has 4 parts. 1, a squamous part here. 2, basilar part is here. And 3 and 4, they are paired, is lateral part. It's lateral part. So let's see each part. But before that, which structure passing from foramen magnum? Spinal cord attached to the brain stem. We know that the spinal cord goes up and attached to the brain stem. This is the location of foramen magnum. Inferior to the foramen magnum, we say a spinal cord. Superior to the foramen magnum, we say brain stem. What is the meaning of a stem? No, root, no. Sag. Okay, this part of the, look at this plant for example. This is roots inside of the floor. This is a stem. Brain stem is like a stem and brain is here. Okay, so this is brain stem. Brain stem has 3 parts. Do you know that? 3 parts of the brain stem. This is a spinal cord. This is foramen magnum. After foramen magnum, we say a spinal cord change to the brain stem, and then we have brain. Brain stem. Brain stem. Brain stem has three parts. Midbrain, pons, medulla oblongata. So brainstem has three parts. Foramen magnum is the location. You can say inferior to the foramen magnum we have a spinal cord, but superior to the foramen magnum we have brainstem. First of all, medulla oblongata, then pons, then midbrain. These are three parts of the brain stem. So a structure passing through foramen magnum, brain stem, medulla oblongata is the first one. The first part of the brain stem. Vertebral artery. What is that? Vertebral artery. Have you studied the vertebral column? What is the shape of the cervical region? Vertebral column, cervical region. What is the shape of the vertebra? It means what is the specific feature? You say this is cervical vertebra. Has two. It has a spinous process is divided to the two parts by bifida spinous process. The body is very small, but transverse process has foramen. Transverse process in the cervical region. Transverse process has foramen. So which structure passing from this foramen? Vertebral artery. Vertebral artery goes to this foramen and goes up. Vertebral artery finally, after cervical region, it's passing from foramen magnum, passing from all of the six up cervical vertebra, transverse process, finally goes to the foramen magnum. Why? Because it can send blood for the brain. Then these two vertebral artery attach together and make one artery, basilar artery. Two vertebral artery attach together and make basilar artery. Is very important for the brain. Anterior and posterior spinal arteries. They are branch of the vertebral artery. They again go down, go out from foramen magnum. A spinal branch of the accessory nerve. Accessory nerve is cranial nerve number 11, and it has some origin from a spinal cord. These origin passing from foramen magnum. Let's talking about different parts of the occipital bone. The first part is basilar part. It's easy. Basilar part is here. I told you, anterior side of the foramen magnum. Anterior side of the foramen magnum is basilar part. Anterior side of the foramen magnum is basilar part. Okay? This is basilar part. Basilar part attached to the which bone? Sphenoid. Very good. Basilar part of the occipital bone is here, anterior side of the foramen magnum, goes anterior and attached to the sphenoid. Basilar part, because it's in the base. Because it's in the base, we say basilar part. Basilar part has a tubercle in the external surface. What is the name of this tubercle? Pharyngeal tubercle. Why the name of this tubercle here is pharyngeal tubercle? What is pharynx? This is larynx. This one is larynx. This is trachea. So what is the relation with here? We say pharyngeal tubercle. What is the roof of the pharynx? Constrictor muscles, there are muscles around the pharynx. Okay. What is the roof of the pharynx? Pharynx has three parts. What is the name of the three parts? Nasopharynx, oropharynx, and laryngopharynx. Pharynx finish, and after pharynx we have esophagus. Where is the location of the larynx? At which level? We have larynx. Look at here, guys. Look at here. This is a skull. Okay, look at here. We know that this is foramen magnum. Foramen magnum attached to the vertebral column, attached to the spinal cord. C1, C2, C3, C4, 5, 6, 7. We have 7 cervical vertebrae. I told you larynx, and here is neck. I told you larynx, Hanjara, it's here. It's at the level of its anterior side. You can touch it in the neck at the level of C3 to C6. So this is larynx at the level of C3 to C6. Guys, this is heart palate. Heart palate is the roof of the oral cavity and floor of the nasal cavity. This is oral cavity. This is nasal cavity. Okay? This area, this is pharynx. This is pharynx. You know that pharynx has 3 parts. One part behind the nose, nasopharynx, A. One part behind the oral cavity, oropharynx. One part behind the larynx, laryngopharynx. So nasopharynx, oropharynx, and laryngopharynx, 3 parts, A, B, C. Roof of the pharynx is here. Basilar part of the occipital bone. Roof of the pharynx, the muscles attach here to the basilar part of the occipital bone, and we have pharyngeal tubercle, and you can see this picture. And I told you, when pharynx finish at the level of C6, we have esophagus. When pharynx finish, we have esophagus. But when larynx finish at the level of C6, we have trachea. We have trachea. Okay? This is the general shape of the neck. And you know that we can use that for the respiratory system, for the digestive system, for the anything else. For example, if you pay attention, air from the external nose goes to the nasal cavity, then goes to the nasopharynx, oropharynx, then comes to the larynx and trachea. This is air passage. But food from oral cavity goes to the oropharynx, then goes to the laryngopharynx, and then goes to the esophagus. Okay? This is the pharynx and larynx location. So for this reason, we say basilar part has pharyngeal tubercle. Lateral part. Lateral part of the occipital bone has condyle. This part. Guys, pay attention, please. This is occipital condyle. One right, one left. Look at here. This one. This is occipital condyle. Right and left. Occipital condyle, right and left. So what is the importance of this condyle? Attached to the C1, atlas. Atlanto-occipital joint. So atlas attached to this condyle of the occipital bone. And we say atlanto-occipital joint. When you found condyle of the occipital bone, you can see one canal, one foramen anterior, one canal, one foramen posterior. Look at here. This is condyle. This is anterior from here, and one foramen here posterior. So when you found the condyle, you can see the anterior foramen and the posterior foramen. Anterior foramen is hypoglossal canal. Hypoglossal canal. And the posterior foramen is condylar canal. Hypoglossal canal is anterior, condylar canal is posterior. So what is hypoglossal canal? Hypoglossal nerve. What is that? Cranial nerve number 12. Cranial nerve number 12 is hypoglossal nerve, and it's for the tongue. Glossus means tongue. So movement of the tongue, the nerve is so these nerves go out from here and goes to the tongue from this hypoglossal canal. What about condylar canal? Condylar canal, we have some artery and vein passing from condylar canal. Also emissary veins passing from here. We are in the lateral part. I told you the condyle, I told you the hypoglossal foramen or canal, and I told you about condylar canal. The remaining part of the lateral side, we say jugular process. These are jugular process. What is jugular? Jugular. Jugular vein. Yes, the artery in the head and neck is carotid artery. Common carotid artery, internal carotid artery, external carotid. The artery is carotid, but the vein is jugular. We don't have carotid vein. We say jugular vein, external jugular, internal jugular, and the vein is jugular. So the name of this process is jugular process. Why? Look at here. Look at here. We have a foramen. This foramen is between occipital bone and temporal bone. Look at this foramen. Between blue and red color, this here. This foramen is jugular foramen. Jugular foramen. So, this foramen is between two bones. What does it mean? It means when occipital bone attached to the temporal bone, we have this foramen. When occipital bone attached to the temporal bone, we have this foramen. And the name of this foramen is jugular foramen. Jugular foramen. And the name of this part of the occipital bone is jugular process. Jugular process. And the name of this notch is jugular notch. Everything here is jugular. Guys, look at here. This foramen is important. Jugular foramen. This foramen, jugular foramen, is between jugular notch of the occipital bone and jugular fossa of the temporal bone. Jugular notch from occipital bone and jugular fossa from temporal bone. When attached together, they're making jugular foramen. They're making jugular foramen. Which structure passing from jugular foramen? Cranial nerve number 9, 10, 11. 3 nerves passing from here. 1, 2, 3, 9, 10, 11. 9 glossopharyngeal, 10 vagus, and 11 accessory nerve. They go out from here. One vein, internal jugular vein. Internal jugular vein also goes out from this foramen. So this foramen is very important. And you should know that. It's located between two bones. Jugular notch of the occipital bone and jugular fossa of the temporal bone. Lateral part of the occipital is finished. Condyle, two foramen, jugular process and jugular notch. You should pay attention to these points in the lateral parts. The last part of the occipital bone is a squamous part. After 5-minute rest, we will talk about a squamous part. Superior to the foramen magnum, the foramen is, the part is a squamous part. Look at here, this region. This is a squamous part, posterior and superior to the foramen. A squamous part, we can consider it. Let me tell you one point about inside of the basilar part and inside of the lateral part. Then we go to this location. Basilar part, from outside, I told you it has pharyngeal tubercle. From inside, basilar part is like this. It has a slope. It has one, oblique surface like this. Outside of the basilar part has pharyngeal tubercle. Outside of the basilar part has pharyngeal tubercle. Inside of the basilar part is here. It has clivus. Look at here, this part. Clivus. Inside of the basilar part. Outside it has tubercle. Inside, what is the meaning of clivus? Clivus. Basilar part. Inside, outside pharyngeal tubercle, inside it has clivus. Clivus. It has clivus. Clivus, when you go to the kindergarten, we have some instruments. Children go up from some steps, then they have this shape. Okay? This is the meaning of clivus. What you say in Arabic to that? You have it, yes? In Farsi we say sorsura. I'm not sure what you say in Arabic. As you can see, it's like that. Exactly, it's like that. It has a surface, it's oblique, and it's like this. Okay? Inside or internal, guys, pay attention. Internal side of the lateral part. So lateral part from outside, I told you. Look at the inside. Inside, it just has a tubercle. You can see that here. It just has a tubercle. Lateral side. From inside, it has a tubercle, jugular tubercle. Lateral side, everything is jugular. Jugular process. Jugular notch. From inside, you have jugular tubercle. It's here. Inside is jugular tubercle. The last part is a squamous part. A squamous part, again, from external and internal surface. Let's see. From external, you can see a tubercle or protuberance. It's here. External occipital protuberance. External occipital protuberance. Okay? It's here. External show you the surface is outside. Occipital is the name of the bone. And protuberance is the shape, big tubercle, protuberance. Exactly like this tubercle, we have one inside, one outside. External occipital protuberance, one inside, internal occipital protuberance. This is external occipital protuberance. This one inside is internal occipital protuberance. Again, outside, Inferior to this protuberance, we have a crest. External occipital crest. Inferior to this protuberance, we have a crest. This is protuberance, this is crest. External occipital crest. Inside, internal occipital protuberance, internal occipital, it means it's same. Outside you have tubercle, inside you have tubercle. Outside you have crest, inside you have crest. Just the name of the internal and external change. For the last time, external occipital protuberance and external occipital crest. Inside, internal occipital protuberance and internal occipital crest. We continue in the outside, external side, external surface. Guys, close to this protuberance, external occipital protuberance, you have two lines. You have two lines. Look at here. You have two lines lateral to the external occipital protuberance, and the name of this line is superior nuchal line. Look at here, is superior nuchal line. This line is important. This line is important, superior nuchal line. Why it's important? Attachment of lines for attachment of the muscle. Which muscle? Trapezius. Trapezius muscle, upper limb, trapezius. Also SCM, this muscle in the neck, SCM, sternocleidomastoid, attached to the ear, superior nuchal line. And another point, guys, when you see, this is neck, this is face. What is the border between neck and face? Lower part of the mandible. Lower part of the mandible is border between face and neck. What about posterior side? What is the border between neck and head in the posterior side? This line, superior nuchal line, is the border between neck and head in the posterior side. Can we find that? Yes, because you can easily find the external occipital protuberance. You can touch this protuberance. It's here. Look at the model. You can touch it here in the lower part of your neck. You have this protuberance, and this superior nuchal line is lateral to this protuberance. Just one line? No. Another line is a little inferior here. Inferior nuchal line. That's one. Superior nuchal line, lateral to the protuberance, lateral to the external occipital protuberance, but inferior nuchal line, lateral to the crest, is inferior nuchal line. For example, if this is superior nuchal line, inferior nuchal line is here. Other muscles attached to the inferior nuchal line, muscle of the neck. Just these two, superior and inferior? No, we have another one. This one is not very obvious. Is the highest nuchal line. Supreme, very good. Is supreme or highest? Is not obvious. Is not obvious, and other muscles attached to this. So from these three lines, highest nuchal line, superior nuchal line, and inferior nuchal line. Superior nuchal line is very important, and because important muscle attached here, and because it's border between head and neck. This is the shape of the, guys, this is the shape of the squamous part from external view. External occipital protuberance, external occipital crest, three lines, and this shape. Let's see the inside. Inside of the squamous part. I told you, we have internal occipital protuberance. We have internal occipital crest. Okay, it's same, external, internal. You can see one plus here. You can see one plus inside of the squamous part. What is that? This plus, the center is internal occipital protuberance. Okay. The inferior line is internal occipital crest. Okay, we know that. What about these two lateral parts? So, I told you in the skull, for the brains, we have a lot of sinus. Superior sagittal sinus, inferior sinus, sinus cavernous, petrosal sinus, and straight sinus. We have different sinus. It means big veins, big veins. All of these veins collect in one place. Superior sagittal sinus, inferior sagittal sinus, a straight sinus. So all of these veins, sinus, collect in one place. This is internal occipital protuberance. So internal occipital protuberance is collection of the sinus. We say confluence of the sinus. Confluence of the sinus means تلاقی. It means different, different veins attached to one side. Okay? And we say confluence. So what happens after that? All of the veins, they come here to the internal occipital protuberance. What happens after that? After that, two sinus go lateral. Transverse sinus. One right, one left. Look at here. Transverse sinus right, transverse sinus left. Send vein to the lateral side. What happens after that? Each side you have sigmoid sinus, S shape, sigmoid sinus. So confluence of the sinus, collect all of the sinus, internal occipital protuberance. Then it has two transverse sinus and two sigmoid sinus. Sigmoid sinus goes out from the skull. Sigmoid sinus goes out from the skull, and the name of the vein in the neck is internal jugular vein. Okay, sigmoid sinus goes out from where? From this jugular foramen. I told you jugular foramen is here. Do you have very thin, pen or something very thin? I can pass it from this foramen. No, it's not thin. It should be thinner. No, very, very narrow. No, like a wire or like pen of the phones. Yes, it's good. Thank you so much. So guys, look at here. Internal occipital protuberance is the confluence of the sinus. Then we have transverse sinus right and transverse sinus left. Then we have sigmoid sinus, S shape. Sigmoid sinus goes out from here, from jugular foramen. Jugular foramen, I told you, between occipital bone and temporal bone. The name of jugular is for internal jugular vein. So finally, sigmoid sinus goes out from jugular foramen and making internal jugular vein. Making internal jugular vein. So for this reason, you can see the groove of transverse process. You can see the groove of the transverse process in the occipital bone. Look at here, these are groove for transverse process. After that, we have sigmoid sinus. Groove for transverse process, no. Groove for transverse sinus. Groove for transverse sinus. Again, guys, what happened? We're talking about this plus inside of the occipital bone. I told you the center is internal occipital protuberance. This lower part is internal occipital crest. These two is groove for transverse sinus. Groove for transverse sinus. And the upper part is superior sagittal sinus. I told you we have it here in the roof of the skull, so it goes back for attaching to the confluence of the sinus. This is groove for superior sagittal sinus. So by this shape, you have this plus inside of the occipital part, the squamous part of the occipital bone, two superior chamber, two superior chamber for the occipital lobes of the brain, two inferior chamber for little brain. Again, look at here. These two for the little brain. You know that little brain also has two hemispheres. So these two are the location of the little brain. These two, the superior chamber for lower part of the brain, posterior part of the brain, occipital lobe of the brain. Brain and little brain, they are here. Outside and inside of the squamous part of the occipital bone is important. We talked about the lines. You can see them here. External occipital protuberance, superior nuchal line. This is inferior nuchal line. This is external occipital crest. You can see all of them in the squamous part. So, thank you so much. Let's talk a little about temporal bone. Let's talk a little about temporal bone, and then we finish at 4:30, okay? We have 10 minutes approximately. I can introduce the general shape of the temporal bone because I told them to the group B. Let me tell you in the group A also. So, guys, temporal bone is important. All of the bones in the skull, are important. But temporal bone has specific reasons, and we should pay attention to that. So, what you think? Why temporal bone is important? Very good. One reason is this: because hearing system is here. External ear, middle ear, internal ear, passing from temporal bone. Another reason why temporal bone is important. Attachment for mandible. Yes, very good. Another point for TMJ joint, temporomandibular joint. So mandible attached to the temporal, and it has synovial joint. So temporal here is important. Another reason. Artery. Vessels, they are related to the temporal. How? Look at here. I told you in the occipital bone, I told you jugular foramen. Jugular foramen between occipital bone and temporal bone. This is jugular foramen. I told you jugular foramen between jugular notch of the occipital bone and jugular fossa of the temporal bone. Jugular notch of the occipital bone, jugular fossa of temporal bone. So temporal bone is important for making this foramen. Jugular foramen, internal jugular vein passing from here. Also cranial nerve number 9, 10, 11 passing here. When you found jugular foramen a little anterior to the jugular foramen, you have carotid canal. When you found the jugular foramen for vein a little anterior to the jugular foramen, you have carotid canal for artery. It's completely in the temporal bone. Look at the carotid canal. The artery of the brain, internal carotid artery, passing from here. So another reason you should pay attention to the temporal is jugular foramen is here and carotid canal is here for the vein and artery. Vein of the brain goes out from here and artery of the brain comes in from here. How many parts we can see in the temporal bone? It has 4 parts, 5 parts. Look at here. What is the landmark? For example, in the occipital bone, I told you the landmark is foramen magnum. Then we divide that. A squamous part behind, basilar part anterior, lateral part lateral to the foramen. In the temporal bone, the landmark is here, external external acoustic meatus. The landmark is this foramen, external acoustic meatus. This is landmark. The foramen, the external foramen of the ear, as external acoustic meatus. You can find different parts. Behind this meatus, you have mastoid part. This is mastoid part. You can touch it. It's here. Behind the foramen, you have mastoid part. Mastoid part. Anterior and superior to the foramen, you have a squamous part. Again, a squamous part. A squamous part of the frontal, a squamous part of the occipital, a squamous part of the temporal, flat and thin. A squamous part. Tympanic part. What is the name of tympanic? Referred to what? Tympanic. Tympanic? Membrane. Tympanic membrane. The membrane between external ear and medial ear. You shouldn't put sharp things in your ear because this membrane damage. The name of this membrane is tympanic membrane. And when we say it has tympanic part, it means this part. This is tympanic part for the ear. Again, look at here. Behind the external acoustic meatus, we have mastoid parts. Anterior and superior to the meatus, we have a squamous part. Exactly at the level of the ear, we have tympanic part. This process goes down, is a styloid process. A styloid process is very important for muscles. A stylopharyngeus, a stylogluteus, a stylohyoid, all of them start from here. This styloid process. A stylogluteus goes to the tongue. A stylopharyngeus goes to the pharynx. A stylohyoid attached to the hyoid bone. And the last part of the temporal bone is petrous part. I told you this part in the base. All part of the temporal bone is not in the lateral side. It has one part in the base of the skull. So this part is petrous part. Look at this. This is a squamous part, mastoid part, tympanic part, a styloid process. Look at here. Also it has one part in the base of the skull. Look at this orange color here. This is petrous part of the temporal bone. Petrous part of the temporal bone. So these are different parts of the temporal bone. So look at the picture. Let me show you in the picture. External acoustic meatus. Tympanic part. A styloid process. A squamous part. Mastoid part. Mastoid part, a squamous part, tympanic part, and this part here in the base of the skull is petrous part. Tomorrow we don't have practical, we continue theoretical. Okay, we continue theoretical, we finish Osteology 1. If we have time, we finish Osteology 2. The day after tomorrow, we go to the practical. So tomorrow again is theoretical, inshallah, and the day after that, we go to the practical. So have a good day. Okay, guys. So guys, let's see some pictures from the skull fractures. Skull fractures, it's usually happens in the accident or falling down in some trauma related to the head and neck. So it has three types. Some types of the skull fracture is linear. It means you don't have any movement in the bones, don't have any change in the shape of the bones, just you have some like line, small fractures like line in the bones. You don't need to do anything, it repairs after time and it doesn't have any problem, no worries, okay? The second type is depressed skull fracture. For example, in some condition, trauma, damaged the skull and sent it down, depressed it. You can see the location of the pressure. Sun can inside. So it's very dangerous. Why? Because it can damage the brain. It goes inside. You can see this shape, for example. You make pressure and it goes inside, depressed. It can damage the brain and vessels. So it's very dangerous and it needs surgery. A skull base fracture. A skull base of the skull has fracture. It's very rare condition. It's very rare condition because base of the skull is related to the neck, is related to the vertebral column. It's here. But in some accidents, in bad conditions, maybe you have fracture in the base of the skull. Fracture in the base of the skull. Fracture in the base of the skull, it's related to the location of the fracture. What does it mean? It means it happens in the anterior cranial fossa, or happens in the middle cranial fossa, or happens in the posterior cranial fossa. So, what can be the sign of these problems? If fracture is anterior cranial fossa, fracture is here. Anterior cranial fossa, what is the sign? This one, raccoon eyes. The bleedings, the hematoma goes to the around the orbital cavity, around the eyes, and become purple, black like this. You say raccoon eyes. Or you have CSF rhinorrhea. CSF rhinorrhea. It means CSF goes out from the nose. Again, it means the problem is in the anterior cranial fossa and in the ethmoid bones, and CSF goes out from the nose. It's very serious problems. CSF goes out from the nose. CSF, how CSF can go out from the nose? How CSF can go out from the nose? From which canal, from which connection it goes out? What does it mean CSF goes out from the nose? How? CSF is around the brain.
So the ethmoid is related to the anterior cranial fossa and to the roof of the nasal cavity.
Yes.
So it will leak from the.
So bones has problem fracture. What about the meninges? What about CSF? Yes, it means bone has fracture, dura mater has problem, arachnoid space has problem, it goes to the subarachnoid space, it reaches to the CSF, this fracture goes to the subarachnoid space, and then CSF goes out from here. You have fracture in the ethmoid bone, and also meninges. Meninges has rupture. CSF from subarachnoid space goes out from the nose. It's very bad condition. It's very dangerous condition. Why? It means your meninges also has rupture. The CSF goes out. Maybe brain has damaged. CSF rhinorrhea. So both of these two signs, it means problem is in the anterior cranial fossa. Problem is for the anterior cranial fossa, for here. Anterior cranial fossa, okay? What about is the fracture of the base, cranial base is in the medial fossa, here. It's related to the ear. Look at this picture. Battle sign. Battle sign. What is the meaning of battle? Battle means? Part of the war? Yes, battle. But one movie we have now, one battle after another or something like this. Battle means yes, fighting, war, like this. Battle sign, it's here. So what happens? The problem is in the middle cranial fossa, or maybe posterior cranial fossa, here. And the blood and hematoma goes here, to posterior side of the ear. This sign, we call it battle sign. Battle sign. And look at this one. CSF otorrhea. CSF rhinorrhea goes out from the nose. CSF otorrhea goes out from the ear. Again, this condition is very dangerous. CSF goes out from the ear. Guys, how we can understand this is CSF? It's not blood, it's not water, it's not...
CSF is a germ-free fluid.
Germ-free?
Germ-free.
What does it mean, germ-free?
You don't have any microbes.
No, we don't have any, lab to test that, just by seeing that. Yes, from the color. Basically, from the color, you can understand it. It's very bright. It's not like blood. It's not like other fluid in the body. It's very bright and milky or yellowish, something like this. And it goes out from ear. It's very dangerous. It means, again, we have problem here in the posterior cranial fossa or medial cranial fossa, and CSF goes out from the ear. Okay, they need very urgent intervention to control the condition for the head and neck. So these are different problems for the skull fracture and different sign. You can see that I told you about Therion fracture, and I told you about extradural hematoma can make pressure on the brain. Craniosynostosis. Craniosynostosis. I told you, all of these sutures, all of these spaces, they will be closed at a specific time. For example, 9 months, this one close. After 1 year, this one close. After 2 years, this one close. They have a specific times. But in some condition, we can see that. For example, we expect this suture close after 3 years, for example. But it close after 6 months. We expect lomboid suture, for example, close after 2 years, but it closed sooner, after 2 months. What happened? The shape of the skull changed. In this condition, the shape of the skull changed. Maybe you have seen some people, for example, the shape of the skull, the behind is bigger, the anterior side is bigger, or they are not pair. Right side is bigger, left side, they have some specific shape. What happens? They are related to the sutures, and you don't want to check that now, and you want to see what is the shape of the skull. Okay, what is the shape of the skull? The most common shape is this. Where is that? It's here. A scaphocephaly. When sagittal suture close very soon. Imagine that. This is a skull. Sagittal suture is here. For example, it make it possible the skull become bigger right to left, but it close very soon. So we don't have this growth to the lateral side. The growth only happens into the anterior and posterior. The shape of the skull change, and it's very narrow and long. It's not right and left. It's just anterior and posterior. This is the most common type of the craniosynostosis. We call it a scaphocephaly. Look at the picture. The brain become long and narrow. scaphocephaly. Sometimes the anterior side of the skull, we have frontal suture or coronal suture. It closes very soon. Anterior side, we have frontal suture. It has right side, left side, between two bright, both of them. If both of them, right and left, both of them close very soon. So what happens? The skull doesn't go anteriorly. It's flat, and posterior side become big. The anterior side is very short, flat. We say brachycephaly. If two side, anterior side close, you can see anterior side is flat, but other part is round. We say brachycephaly. Sometimes this condition is one side. One side close soon, but one side, for example, is normal. You can see they are not symmetric. One part is big, one part is small. Anterior pelagiocephaly. Anterior pelagiocephaly. So these three. This one, scaphocephaly, when sagittal suture close soon, is the most common. Anterior pelagiocephaly, one side of the frontal suture close soon. But brachycephaly means both two sides close soon. Number 3 and 4 is very rare. Lomboid suture close very soon. Lomboid suture close very soon. So the posterior side is not round, it's flat, and anterior side is round. We say posterior pelagiocephaly. We don't have picture for that. And this one, metopic synostosis. What is metopic suture? We don't have metopic suture. But here we're talking about metopic synostosis, closing metopic suture very soon. What is metopic suture? Metopic suture. I told you frontal bone, it was pair in the fetus and in the newborn. After 6-9 months, it's fused and we say it's single. Before that, we have this suture between two bones. We call it metopic suture. So when is the normal time for closing this suture? It's 6 to 9 months. Imagine it closes after 2 months. What is the shape of the skull? Is like this. This anterior side of the frontal closes very soon. Other part become big. Anterior side of the skull is like triangle. We say trigoencephaly. We say trigoencephaly. Trigoencephaly. When metopic suture close very soon. And the last one is acrocephaly. Acrocephaly. The top of the skull goes up. It's like tower. It's very go up. Okay, what happens? The lomboid suture close soon. Frontal suture close soon. They don't go posterior anterior side, just go up. Okay, just go up like this. Just go up anterior. This one, frontal suture is closed soon. Lomboid suture is closed soon. Just the skull can go up like this. We say acrocephaly, cone-like head or tower-like shape. You should know that if I ask you about, for example, scaphocephaly, you should know what is that. If what is about brachycephaly, what is about acrocephaly, trigoencephaly, these shapes and this type of the craniosynostosis. It means suture close very soon. Which structure passing from these foramens? From here, from here, from here, from here, 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 here. Nerves. How many nerves we have? What is CNS? Central nervous system included? No. Now I'm asking about CNS. CNS including brain and spinal cord. Brain, all of the brain, little brain, the brain stem, and a spinal cord, we call it CNS. What is PNS? Peripheral nervous system, including how many nerves? How many nerves in the PNS? Anatomist, how many nerves we have in the PNS? 31, 31, 12 kilometers. Yes. When we say CNS, central nervous system, is brain, it means brain means cerebrum, مخ, little brain, brain stem, and spinal cord. These are CNS. When we say PNS, peripheral nervous system, means all of the nerves going out from CNS. It has two parts. One part is cranial nerves. So CNS, we know that. Brain and spinal cord. But when we say PNS, it has two parts. 12 cranial nerves. Cranial nerves means nerves going out from brain. 12 pair, right and left. And 31 spinal nerve. 31 spinal nerves. Okay, they are PNS. So these 12 cranial nerves, they should go out from the skull. Or some of them sensory, they come into the skull. So they need some foramen, some canals. Do you know the name of the 12 cranial nerves? Olfactory, yes, you studied in the respiratory. Cranial nerve number 1. Olfactory nerve is cranial nerve number 1. Cranial nerve number 2 is optic nerve for the vision. These are sensory. They go inside of the skull. Cranial nerve number 10, vagus. You studied the respiratory system, also cardiovascular system. So vagus is very important. Cranial nerve number 10. Cranial nerve number 7, facial, for the face, facial nerve. Cranial nerve number 9, glossopharyngeal. Okay. So all of these foramens are for nerves, vessels, and vein. Frontal bone. Let's talking about frontal bone a little, then we continue in the next hour. Frontal bone is pair bone in the fetus and in the newborn. But after 6 months, 9 months, we say it's single bone. It's not pair. I told you the name of the suture was metropic suture. It's close in the 6 months old. Frontal bone has 4 parts. A squamous part. I told you, different bones, they have a squamous part. A squamous means thin and flat. Here, this part of the frontal bone is a squamous part. This part of the frontal bone is a squamous. Sadaf, a squamous part. Nasal part. This part of the frontal bone is nasal because attached to the nose. Orbital plates. They are roof of the orbits. Roof of the orbit. Look at this shape. Look at this model. Frontal bone, a squamous part. Nasal part, these are orbital plates. Roof of the orbits. Orbital plates. Roof of the orbits. And finally, zygomatic process. Zygomatic process. Because attached to the zygote. You know that different bone in the skull, they have a process. Process, usually the name of the process is look like the name of the bones they attach to that. For example, we say frontal bone has zygomatic process because attached to the zygomatic bone. Look at the zygomatic bone here. This is zygomatic bone. Okay, it has three processes. One frontal process because attached to the frontal. One maxillary process because attached to the maxilla, and one temporal process. So this bone, zygomatic bone, has three processes with the name of three bones: maxillary, frontal, temporal. Okay? Frontal bone, let's explain the squamous part. A squamous part. A squamous part, you have two arch, superciliary arch. We have two superciliary arch. You have two superciliary arch. Okay? It's here. In the men, the superciliary arch is bigger. Why? Because the sinus inside of this region is bigger. Frontal sinus in the men is bigger, so this arch is bigger. Behind the eyebrow, it's here. Superciliary arch. Between these two arch, you have flat region, glabella. So we have two arch, superciliary arch. Inside of the arch, you have frontal sinus. Between the two arch, you have flat surface. This is glabella. This is glabella. Glabella. Also, this arch has a border. This arch also has a border. We say supraorbital margin here. This margin here, we say supraorbital margin. Look at here, this one. Supraorbital margin. Supraorbital margin has foramen. Supraorbital foramen. So supraorbital margin has foramen, supraorbital foramen. Supraorbital foramen is between medial 1/3 and lateral 2/3. It means this is supraorbital margin, it's here. Medial 1/3, lateral 2/3. Okay? Supraorbital foramen, also you can see infraorbital foramen, but infraorbital foramen is in the maxilla. Infraorbital foramen is here in the maxilla. Supraorbital foramen is here. Also, you can see two round parts in the squamous part here. Here and here. We have two round parts. You can see in the frontal region. Why they are round here? Frontal tuber. Why they are round? Frontal tuber or frontal eminence. Why we have this roundness here? One here, one here. You know that the ossification here is intramembranous because they are flat. Intramembranous ossification, they have one center, then like a circle they increase. These are center of the ossification. Then the membrane ossified and calcified because you can see this round. Also in the parietal bone, here you have some roundness. This is parietal eminence, this round area. The frontal bone is here. These are primary center of ossification. Center of ossification. A squamous part also has external surface, also has internal surface in the medial side. Let's see the medial side. Inside, not external surface, internal surface. So you can see some lines, it show you the location of the frontal lobes of the brain. Also you can see one crest here. You can see one crest. Here. inside of the frontal squamous part, inside of the squamous part of the frontal bone, you have a crest. What is the name of the crest? Frontal crest. What is the function of this crest? For vessel. We have a crest here, frontal crest. Why we have crest? Why we have crest? Yes, finally it goes down and attached to that point. But no, what is the function of the crest? It's for meninges. Do you know what is falx cerebri? Falx cerebri. Do you want to know what is that? Or you don't need to know? You only want to know. Falx cerebri is a layer from dura mater. It's a layer from dura mater. Dura mater, meninges. Dura mater has some wall that comes to the brain inside between two hemispheres. You know that we have two hemispheres in the brain. One wall is between them. This is falx cerebri. Falx cerebri. Falx cerebri attached to the frontal crest. Look at this wall. From dura mater, from meninges, you can see a wall between two hemispheres, brain, right and left. This wall, it's falx cerebri. It's a part of dura mater. So as you can see, it comes anterior and attached to the frontal crest. Attached to the front and fix it. The location of the brain is always fixed when you move your brain. Okay? By these meninges, by this dura mater, it has also other layers here between brain and little brain. We have one wall like this between brain and little brain. We have tentorium cerebelli. It's here. So these are from two dura mater, and the name of this structure is falx cerebri. Falx cerebri, and the meaning of falx is this. This instrument we use, for example, for cutting some plants, this is falx. What you say in Arabic? Okay, it's falx cerebri. Falx cerebri attached to that. This is a squamous part. A squamous part of the frontal bone. We should talk about orbital plate, we should talk about zygomatic part, nasal part, and also we should continue other bones. If you have any question, you can ask. If you don't have any question, I will see you here at 3 p.m.